Hello, I'm Dr Annalene Weston, dental legal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dental legal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. So today I'm talking with my colleague and fellow dental legal consultant, Dr. Kiran Keshwara. Hello, Kiran.
Hello.
And we're talking today about a topic that's becoming more relevant by the day in Australian dental clinics. So Australia is a fast-changing, culturally diverse nation. And in fact, the data shows us that over half of us were born either overseas or have a parent who was.
Yeah, that's right, Annie. Based off of the 2021 census, it's 51.5% of the Australian population was either born overseas or have a parent, at least one parent who was born overseas. And we'd anticipate that that number will increase with the upcoming August 2026 census. And more relevantly for those of us in dental practice, when you look at the 2021 census, over 300 languages are being used in homes across the country. And as clinicians, I would think most of us would have experience trying to talk to or communicate with patients who have limited, little or no English language skills. And this can make for a very complex and sometimes confusing interaction.
No, absolutely. And I've definitely come across this in my clinic. Interestingly, I work with 10 other practitioners and I'm the only one who is not speaking a second language. So that reflects very poorly on me, I know. But I know that separate to this, many colleagues do face this language barrier issue that we're talking about today on a day-to-day basis.
Yeah, and that can become quite frustrating, as well as making us question actually whether the patient and the clinicians actually understand each other and whether the medical history you've obtained is accurate or whether the consent that's been provided, especially for that extensive, expensive or reversible treatment, is actually valid or not. Personally, I've struggled to explain treatment options and risks and warnings to patients who speak a different language to me. And even when they attend with family members who are quite often children, the question will linger in my mind as to whether the patient actually understood what I've been telling them and if I've answered all the questions that they have. And as you know, Annalene, I speak Gujarati and understand Hindi and a couple of other languages. Despite that, I can struggle with speaking to my Gujarati or Hindi-speaking patients when it comes to trying to explain to them what an extirpation is or, the risks involved with an oral antral communication without resorting to the use of English for the most important words like nerve, sinus, specialist or root.
Yeah, that's really interesting. I've never thought of it like that. So what other hurdles do you think, Kiran, then we can come across when treating patients who aren't speaking the same language as us?
I think, and I've briefly touched on it already, I think the biggest hurdle is what we have is the family translator. And we've all seen it. An elderly patient comes in with their teenage granddaughter. The teenage granddaughter then translate. But you sort of sit there wondering, did they actually tell the patient about the dry socket? Or did she just say, the dentist said you need to have the tooth taken out?
Yeah, that's absolutely true. And I'm sure we've all experienced this where you wait patiently while your patient and their family member have a really long and animated discussion. And you're curious to hear what the patient's questions are. And then the family member turns to you and says, he says yes.
Yeah, exactly. Yeah. One time I had an elderly Gujarati speaking patient who attended with her daughter, and the patient was telling her daughter in Gujarati that she was taking some medication. And the daughter said to her, he doesn't need to know about that. It was only because I speak the language that I picked up on it. But if it was another patient using another language, then I could have potentially been working off of a false medical history. And this is a massive clinical risk.
Yeah, it really is, isn't it? So do you think it's still okay to use family members then, Kiran, to help us translate?
Essentially, if a patient doesn't fully understand the risks, limitations, costs, you don't have informed consent. And if you don't have informed consent, then you're working on risky grounds. Personally, my preference would be to use a staff member if possible or a translation service. But if a family member is the only option, I think it would be wise for us to insist for it to be an adult rather than a child, so that at least we know that the person translating has somewhat understood what we're saying to them. What we do need to remember when using family, though, is that the family may put a filter on their conversation with the patient because they have an emotional stake in the discussions. For example, they may not want to scare their mom, or they may want to encourage the patient to have a certain treatment.
Yeah, that is a risk, isn't it?
Mm.
And I think, yeah, sometimes when we think about this with the things being lost in translation, it's easy to forget that the reason for that loss could be genuine concern on the fact of the person translating, because they know mum's scared of needles and they don't want her to focus on that aspect, perhaps. Okay,
Yes.
so I'm pretty confident that you've got something to share with us about what ARPRA say about this.
I do. The ARPRA Shared Code of Conduct says that good practice includes that you take all practical steps to meet the specific language, cultural, and communication needs of patients and their families, including by using translating and interpreting services where necessary, and being aware of how these needs affect understanding. And we should endeavor to confirm a patient understands any information communicated to them. So essentially, the onus lies with you as the clinician as to how you use interpretation translators, whether they're family members or otherwise.
Yeah. And of course, you need to document that too.
Correct.
The way that, the way. So another thing I've come across, Kiran, with some of my patients who don't speak English as a first language, is I can find that they tend to agree with everything that I say.
I agree. And this is because in many cultures, healthcare providers are held in such high regard that a patient will say yes to anything simply out of respect, even if they're totally confused. So if a patient is giving you one-word answers, nodding and smiling at everything you're saying, that might be a red flag. And you need to be asking the question, does the patient really understand what I'm telling them, or are they simply being polite?
Or fearful, of course, fearful of not wanting to get on my wrong side. So how am I going to break through that, do you think, Kiran?
I think this is going to sound a bit counterintuitive, but I would actually encourage more conversation with the patient. But this time we let the patient do most of the talking. So ask them open-ended questions and ask them to explain back to you what you've said. And regardless of the language that the patient speaks, even those that are fluent in English, I think this is a great way of checking back the patient's understanding.
Yeah, agreed. Absolutely. I'm a big fan of the retail. So aside from family and staff members, there are other options available we need to explain, aren't there?
Yes, there are. And I think the most foolproof option would be the use of a professional translation service. The Australian government does have a service, the Translating and Interpreting Service, which is TIS. And this can be a very useful tool. Dental practices can register with TIS and then booking for an interpreter whenever the service is needed. But there most likely will be a cost associated with this. Another resource to mention are directories such as in Victoria, we've got the Health Translations Directory, the New South Wales Multicultural Health Communication Service, and there's, of course, teeth.org.au, where you can find leaflets and fact sheets such as information about denture care, post-extraction care, looking after children's teeth, which have been translated into the most common languages.
That's super helpful, isn't it? And of course, I recently became aware, and it's actually going to be a subject of another podcast later on this year, that you have access to translator services for patients who are deaf also, to ensure that you get valid consent. Yeah. So I've actually arranged to speak with a dental colleague who is a translator, an Auslan translator. So it'd be really interesting to see what she has to say about this too.
Yeah.
So Kiran, technology. Can I not just use Google Translate? Is there not some sort of AI solution for this?
I think there are options and there are tools. I wouldn't say AI and technology is the solution. AI translation apps or Google Translate are great for, simple translation services such as Where Does It Hurt or Open Wider. But when it comes to complexities, for example, trying to explain root canal treatment and costs and risks, I wouldn't be relying on AI for this. As we all know, AI can hallucinate. And if we ourselves don't know what the AI is spitting out in a different language, how can you be sure that the information given to a patient is accurate and what you're trying to convey to them?
No, that's absolutely true. We took the kids to Japan last year, and it was fascinating seeing how Google Translate was fantastic,
Mm.
right up until it wasn't. And so when you've got something as critical as a conversation of consent at stake, you really want to be getting that right. So talking of tools, I know that my intraoral camera is my best friend, and I probably use that to explain things more than I do my words sometimes.
That's actually really good. And I think images is very useful. A picture will tell 1,000 words. So taking photos of teeth will definitely help to explain things to a patient a lot better. Even if sometimes, get the pen and paper out and just draw a couple of images, a couple of drawings might help make things a bit easier for the patients to understand as well.
Yeah, for sure. I'm a big advocate of that. And I actually have a printed picture of a tooth that I keep in my surgery for those purposes. I used to draw the tooth, but sometimes it really doesn't look like a tooth. And while that's fun, it's not necessarily helpful to the patient if it doesn't look like a tooth. So before we wrap up, Kiran, what do you think the must-dos are for a dental practitioner's clinical notes? So if things go wrong, the dental board comes knocking, what needs to be in that file in these situations?
That's a great question, Annalene. I think there are a number of things to document. When it comes specifically to the situation where you've got a patient who doesn't use English as their main language or doesn't understand English, I think we need to document the language that the patient does use and the language that you attempted to communicate to them with. So don't just say non-English, specify the language. We need to specify how we've tried to communicate with the patient. Did you use TIS or an interpreter? Did you use a family member? Maybe you've advised the use of a professional, but the patient declined. Although, when it comes to the higher risk treatments, I would try to push for a professional translation. And then also mention the aids that you've used, whether you've used 3D models or translated leaflets, the drawings that we were talking about. I think all of those things, along with the regular things that you would be putting down for an English-speaking patient, need to be included in your notes.
No, that's great. And of course, the drawings, I scan those in and I give the hard copy to the patient to take away too. So it sounds like it's all about building a communication trail, really, as much as it is about building a clinical one.
Yeah, exactly. And by using the resources we've spoken about today and your communication skills, both verbal and non-verbal, we know non-verbal skills, body language tells a lot. You can build a rapport and a relationship with your patients and hopefully avoid the stresses and frustrations associated with misunderstandings, miscommunications, and subsequent patient complaints.
Yeah, that'd be fantastic, wouldn't it? So thank you, Kiran, so much. And thank you all for listening. We do hope this podcast was helpful to you, and we look forward to sharing more guidance with you in the future. If you like dental protection podcasts and you'd like to hear more, please subscribe and leave a review.